Hey everyone, I'm here today with Eric North, who's the CEO and founder of Potomac Rejuvenation Center. He just flew down to beautiful Miami. He's a very good friend. We've met because we both own anti-aging clinics.
Right.
And I wanted to have him as a guest because he's got some wonderful experience managing his own practice. As well, he's an older guy like myself, and so we can actually speak from experience about how the HRT helps both of us. How did you get involved in HRT, like first experience, and then how did you end up transitioning? Because I'm assuming you were like me, you went to a clinic,
Yeah.
you know, got some type of therapy, changed your life, and then somehow there had to be something in your mind that made you decide you want to do this and you want to help other people.
I think it was a point where I was really pushing. I'd pushed myself very hard in my real estate career, and I was a really ethical, good agent in Washington D.C. Everyone knew that I was going to do a good job when I worked with them, and I felt like it was very important to me to always be at my highest level and do a good job and have my very happy clients. And I started feeling tired. I had been a personal trainer. I was in really good shape up to that point. I was always a type A personality, not because I'm so competitive. I'm competitive with myself. I always want to do better. And all of a sudden, I felt like 3 or 4 days a month, I would just lack energy, and I didn't feel, I was in a mood that's not normal for me.
Right.
And I just felt kind of shut off, and it wasn't feeling good. And I had my doctor, and I knew nothing. I didn't know what steroids really did. I knew they made you have muscles, but I didn't know they were testosterone. That's how much of a novice I was. And so I fooled around a bit with my general physician, and you don't get therapy that way. It's just a Band-Aid, and then you stop doing it, and it just kind of goes away. It's not really a very permanent solution. So a friend of mine, I really had no idea. I was kind of frustrated with the whole process, so if I really wanted to keep doing it. And then, things happen. A friend of mine mentioned a clinic in Florida, and I checked it out, and I started, and I felt good. In a few weeks, I felt good. And then every time I'd do a refill and get another set of therapy, the testosterone, HCG, and the anastrozole, I'd feel better. It would be 10 weeks, I'd feel better. 10 weeks, I'd feel better. And more was happening. I was getting more done. I was making more money. I was selling more homes. I was, working out again. I was feeling good. And I have a way. I just start talking to people. I try to make people feel good that I'm working with, or anybody. And so the guy that I was working with at the clinic down there, he said, "Hey, the owner's looking to expand business and have a partner somewhere, and we think you're cool. So do you want to set up a conference call?" So we did, and I was really excited because I wanted to make sure this was always in my life too. This is something that became so important to me. How do I keep it in my life? Well, now I can control it. I can actually open a business maybe in D.C.
Right.
So I went down there, and it was a big step. I had to really think about it. And I went down there for a week and spent time with everyone in the office, and a lot of time with their CEO as well. And he really took me under his wing. And within a few months, I was ready to open in D.C. And I really was. I used a lot of their model, and then I realized that I needed to make my own model. And so it's grown from there. And that was in 2011.
Wow.
And we're very different now. I mean, we have our own. We're a very fast forward, very modern clinic. We're always on top of what's happening.
Yeah, well, that's how we met. We met at one of the
Right.
A4M conferences. I know you're sort of a big, fan of the conferences. I go to a couple a year, at least a couple a year myself. We're always continuing to educate. There are always new compounds, but
It's not just the education too. It's also being part of that community of the anti-aging community, the doctors
Right.
and the scientists, and really. They keep you, and by being there, it keeps you very relevant in your own practice.
Exactly.
So, yeah.
Well, things change so fast that
Right.
if you don't attend those, I think that's one of the problems that I see with some other clinics, but that also with like general practitioners that incorporate testosterone therapy into their practice. I think because they don't specialize in it,
No,
they really don't sort of stay current with what's going on.
Current, no.
And I've had a lot of guys that have come to me that did testosterone through their own general practitioner or through their urologist, and they stopped for whatever reason because they had to go in for injections into the office. It was only every 2 weeks. didn't have the HCG. They weren't doing follow-up blood work. All of the stuff that we think is critical to our practice, those doctors were not really incorporating into their own management of their clients.
Well, I always say that's TRT that's designed to fail. It's designed to give you failure results. It's not designed to have continuous results. It's designed to make you tired of doing it and stop doing it.
Right.
Okay, and then what's your alternative? I don't feel good now. How about antidepressant med? That's usually the next step, or it's the first step before they give you testosterone at all.
Right.
Okay,
and how many guys do you think are walking around that are taking Prozac?
I think they're walking around and they're really being cheated out of life.
Yeah.
I really do think. I think that they made a decision based on their best of their own knowledge. It's not something I judge anyone for. I think we are taught to listen to our physicians, and our physicians generally medicate rather than fix something.
Yeah.
So, fix issues,
I was having a discussion the other day. I mean, one of the things that I think is sad about, our space and what we do is that, it seems that doctors oftentimes are giving people medications like blood pressure medication or cholesterol medication that allows them to continue living really unhealthy.
Right, right.
It's basically, here's a product that will keep you alive, but because I don't force you to change, your health, you're going to be, first of all, addicted to that medication forever, and B, you're going to walk around and not feel that great, as opposed to trying to guide them to better health, which they probably wouldn't need. The blood. In many cases, I bet you they would need the blood pressure meds or cholesterol, antidepressants, the same.
Well, that goes back to, I think to myself, when we're trying to optimize ourselves, so we're trying to optimize ourselves hormonally to get to a good state so we can be balanced, okay? And once you have a good state of balance, but you have to feed that balance. You have to feed it with a lot of things. There's a lot of things that play into our hands, and we have to think about our food supply. Like number one thing, so you can take all these medications and you don't have to change your food sources. They can be all the processed foods that are easy to make, the things that are microwaved and all that, and then they're all in plastic, so you have to think about all the stuff that's probably leaching into your system, which is not a conspiracy theory, but it's a very known fact that there are a lot of estrogenic substances in processed food and packaging, and then you're just a big mess, okay? And
listen, I'm not going to push conspiracy, but I would not doubt if the food industry is in bed with the pharmaceutical industry. Like, we'll get you sick with our unhealthy food.
Of course.
Pharmacies keep them alive so they can continue eating the garbage.
And the health insurance industry as well. It's all, and everything's kind of in league. It's all tied into business, really, okay? And there's choices we can make, but there aren't a lot of choices available to most people, and most people don't know what to really do and what to believe even.
Right.
Told 1 week that we can eat meat, 1 week we're not supposed to eat meat, 1 week we can take vitamin D, 1 week we can't take. Everything is all. I just follow sort of a diet of what is good quality food. Okay?
Exactly. It's like not to get political, but like fake news.
Well,
right, like I feel like these studies,
there's a lot of fake
the studies
news
that exactly, like you have to really look. I think historically, who financed the low fat?
Okay, the first
studies.
Well,
you know what I mean?
Of course, food processing companies. But when I started, here's an interesting thing. So when I started my clinic, I knew it was the right thing to do. There was a lot of pushback around me. Friends didn't like what I was doing. They weren't comfortable. They didn't understand it. Other people just thought I was a bad guy or something. But then what happened, I knew it was still the right thing, and people were coming in. We were getting patients that were really happy. They were, their lives were improving. I knew it was the right thing to do. It really did improve my life. So, the same year, like a year later, there was all these studies that had came out. One study came out, but the media jumped on it, and it was totally debunked. Of course, later on, of course, the media barely talked about that.
Right.
But we spent about 6 months with panels on news channels and nightly news about testosterone is going to kill people.
Right, right.
And it was all wrong. And it was one study. It was poorly done. It was poorly done on very old patients that were in their 70s and 80s in a nursing home.
Right.
And so we had to fight through these things. We had to fight through this stuff to tell the truth. And
exactly.
Now the first thing people do when they call me, first thing they say is, "How can I make an appointment?"
Right.
Back then we had to talk about it a lot more.
Yeah, it's true. I think sadly with the way that news is today. When I was younger growing up, I feel like the news was the news.
Yes.
And now it's about eyeballs. It's literally whatever is sensational.
Sensation. Yeah.
post it. If there's something crazy about hormones or some new medication or some new diet, hype it up. But then if it's found to be false, never do any type of retraction.
Never.
So it's sort of shocking the way that the world works. Same with politics. Just make the most sensational stories possible, and have as many eyeballs as possible. And who cares about the truth anymore?
Well, say it enough times, it's true. Say
Right.
it enough times, it becomes the truth.
It's true. Except for you and I know that.
But we're not
the testosterone.
We know it's the truth. We
Exactly.
that's why we do what we do, and it's not for everyone. Okay.
Yep.
It takes a very strong mind to know you're doing the right thing.